is a joint federal-state program, partially funded by the federal government and partially by the state, and it's really a safety net program. So if you're living at or below the federal poverty line, so again $22,000 for a family of 4, you would qualify for Medicaid. So it is the safety net program for the indigent, so people living below the federal poverty line. If you look at who's in Medicaid, 2/3 of the people in Medicaid are children. 1/3 of the people in Medicaid are senior citizens. And then if you look at the costs, the 2/3 of the kids only spend 1/3 of the cost, and the 1/3 of the senior citizens spend 2/3 of the cost. So kids are a great investment in Medicaid, and Medicaid primarily is a program to cover a very large number of children. Medicaid is the joint federal-state program for people living at or below the federal poverty line. Medicare is a federal program that is for people who are 65 years or older. The Children's Health Insurance Program, abbreviated CHIP, is the state federal program for the children of the working poor, meaning people who are between 100% and 200% of the federal poverty line would qualify for CHIP. And when I say people, I mean people under 19, which would be between a family of 4 living between $22,000 and $44,000. One of the goals of the hospital back in the mid-1990s when they started Texas Children's Health Plan, a provider-sponsored HMO, was that we wanted to be at the table helping children and families get access to healthcare, basic healthcare. So we at Texas Children's Health Plan and at Texas Children's Hospital have wanted to conduct this study periodically to see if in fact we are part of the solution, and if we are helping families get connected to the essentially the insurance benefits to which they have access to.
So this research commissioned by Texas Children's Hospital actually had 2 primary goals. One of them was to track over several years the percent of children in the greater Houston area who are covered by health insurance, and for those not covered to understand why. There were 4 primary findings from the study. First, focus on the blue line in this graph that connects the 4 squares that are plotted above the years 2003, 2006, 2008, and 2011. You can see after climbing from 2003 to 2006, and then again from 2006 to 2008, unfortunately from 2008 to 2011, the percent of households whose children are covered by health insurance went down in 2011. You can also see from the graph that the percent of covered children, both the increase and the decrease, parallels the employment situation, which is reflected in the red diamonds. The second major finding of the study is captured by the 2 graphs on this slide, which help account for the drop in the percent of children who covered. The graph on the left, labeled working, shows that in 2011, the percent of households in our sample with 1 or more parents working had decreased. And the graph on the right, labeled insurance, shows that of those working, the percent who can get insurance at work is lower in 2011 compared to 2008. The third major finding was, on the positive side, you can see from this slide, the awareness of the Medicaid program, as indicated in the graph on the left, is up over the years. The same is true for awareness of the CHIP program, which is shown on the right. So public awareness of these programs as a safety net has been increasing. And finally, in the 4th major finding, although the drop in covered children is unfortunate, the safety nets of Medicaid and CHIP are doing their job. As you can see from the graph on the source of coverage, that is, for those that are covered, the source of coverage, the percent covered from work is down significantly in 2011, but the percent covered by Medicaid and CHIP more than doubled. So overall, I would say that in a country where we pride ourselves in caring for those less fortunate, especially children, it is good to know the safety nets of Medicaid and CHIP are working as intended.